Thank you. Good morning, everyone. I'm Pratik, founder and CEO of Finnadvance. And today I'm calling you from France, where I'm attending the Organ-on-Chip conference. Finnadvance is a team of engineers and scientists with more than 40 patents and 20 patents and 40 publications among our team members. And we are guided by this excellent group of advisors who have previously made exits in biotech and medtech industry. And the challenge for this team is trying to solve is this very expensive and time-consuming drug discovery process, which everybody in the audience knows takes more than 10 years for every single drug to be developed and costs upwards of $2 billion. We think the problem is using animals which are not representative of human physiological conditions for preclinical screening. To solve this, Finnadvance is developing a microfluidic organ-on-chip platform, which allows for generation of human-like biological barriers. We are focusing on blood-brain barrier, the vasculature, the lung, gut, and finally, organoid across barriers for immuno-oncological applications. I will today focus on the blood-brain barrier modeling, which we have been able to do on our platform. Our platform is very different from any other existing platform in a way that it preserves human physiology. The endothelial cells are under shear stress culture, but the astrocytes are under static culture, which allows to form these very confluent and impermeable barriers, which are seen similar to in vivo image barriers. We have also taken electron microscopy cross sections to show the intact and close contact cell-cell junctions of the endothelial cells formed in our blood-brain barrier on chip. Now, most of us are used to using transfer inserts, but recently microfluidic systems have shown an order of improvement over these transfer inserts, but still the gap between in vivo reported BBB permeabilities are very far away. We are the only platform to date which narrows down the gap between in vivo and in vitro permeabilities. You will also see on this graph, the gap between the variation of the different chips is very negligible on our platform. On our platform, we are also able to show the clinical trial level results where we are able to show a fully intact barrier. Then we are able to open the barrier by using focused ultrasound or by using a hypertonic shock and able to measure the opening parameters and then finally recover it. This is very critical for developing new therapies for glioblastoma and for neurological applications. So in summary, we have made this high throughput platform, which is compatible with all existing robotics, incubators, and microscopy systems, and it allows you to screen small molecules, peptides, exosome therapies across BBB and several other biological barriers. One of the very cool things what we have been able to show, the inflammation given by TNF, alpha, or LPS on the BBB, but recovery of these inflamed barriers by fusanthine and imipramine in vitro, which has been very challenging to do. We have started publishing our papers starting this year, and we are backed by 14 patents fully owned by the company. Our platforms, though being very simple and straightforward, are able to replicate even very complex cancer niches, as you will be able to read in this oncogene paper we published last week. In our lowest throughput, our platform is able to replace at least 24 animal equivalent experiments, but we are scaling and currently providing up to 96 assays per unit, which is world leading compared to any of other competitors on the market. We are able to serve everybody from the preclinical CROs to big pharma and even the big chemical industries. And this is truly a platform which is plug and play, and you do not need any other external device to communicate or to control it. Today, we are raising a 5 million euros late seed funding to expand our business to Japan and US and to have 25 Japanese customers by the end of this year. This is my small team of 22 people from Finland, and I would be happy to take some questions. And especially for the pharma companies here, if you want to develop an organotypic model in less than 4 weeks, we can deliver the first models to you. That is our promise. We have customers in 9 countries, and we have never failed them. So please, I thank you for your attention, and I could take some questions now.
Okay, thank you very much.